Up to what age is thumb sucking considered to be physiologically normal? Physiologically normal, all right? कब किस एज तक हम कोई इंटरवेंशन शुरू नहीं करते हैं एंड इट इज कंसिडर्ड एज नॉर्मल? 1 year, 2 years, 4 years, 5 years. What age is thumb sucking considered? Yes. What should be the answer? Up to what age intervention is not needed? Thumb sucking habit is considered normal. Up to 4 years of age. Actually, the range is between 3 to 4 years. Alright? 3 to 4 years. So, up to 4 years of age. After that, क्या होता है? हमारे परमानेंट होता है ना, इरप्ट होने वाले हैं, तो इरप्टिव फोर्सेस जनरेट होंगी, तो थंब सकिंग होगा, तो उससे क्या होगा? वो अपनी उस जगह पर, अपनी प्लेस पर नहीं रख होगा, है ना, मालोक्लूजन के चांसेस होंगे. सो इट इज कंसिडर्ड नॉर्मल अप टिल दिस नॉर्मल to 3 to 4 years. Alright? To 3 to 4 years of age. Thumb sucking is considered normal. Moving on to the next question. Mesial step in deciduous dentition represents distal terminal of maxillary second molar and mandibular second molar coincide. Distal terminal of maxillary second molar is mesial to the distal terminal of mandibular second molar. Distal slope of the maxillary canine coincides with the distal slope of mandibular canine. Or distal terminal of maxillary second molar distal to the distal terminal of mandibular second molar. Mesial step. Yes. What should be the answer? Option 4. Distal terminal of maxillary molar is distal to the distal terminal of mandibular second molar. See, इससे हमारा ये क्या बन गया? Mesial step. Mesial side पे step. This is the distal terminal of maxillary molar. This is the distal terminal of mandibular molar. And this is distal to the mandible. Alright? और distal step में क्या होता है? Distal step will be like this. इसमें क्या होगा? Maxillary distal terminal क्या होगा? Mesial to the distal terminal of mandibular second molar. And इसमें ये coincide करते हैं distal terminal, that is known as flush terminal plane. Alright? Clear? Moving on to the next question. Silver diamond fluoride, STF, is not indicated in which of the following situations? High caries index, uncooperative child with multiple restorations, pulpal involvement, or restoring multiple caries teeth in single visit. Very simple and direct question. When there is pulpal involvement, then we need to go for pulpal therapy. Then STF will not be applied. Clear? Then Sub SDF का when there is pulpal involvement, then there is no use of SDF. Which material is commonly used after partial pulpotomy? Partial. Which material is commonly used after partial pulpotomy? Now the gold standard material after vital pulp therapy is MTA. Alright? MTA. Calcium hydroxide, traditionally it was used, but it has tunnel, क्या बोलते हैं उसको हम, टनल डिफेक्ट्स. इसकी absorption की प्रॉपर्टी की वजह से अब हमारा which is the gold standard after partial pulpotomy, which material? MTA. Alright? It induces dentinal bridge. It does not have tunnel defects. So, MTA. Clear? Avulsions and luxations are more frequently observed in children. Statement 1. And statement B is saying crown fractures and crown root fractures are more commonly seen in adults. In this case, both these statements are true. Both statements are correct. Due to the dense alveolar bone, adults they are more prone to fracture. Alright, they are more prone to fracture. So, both statements are true. A dentist is managing 2 cases of open apex in young patients. Case 1. A patient presents with a tooth exhibiting a severe type 2 fracture with an open apex in a young permanent tooth. The pulp is vital and the tooth is free of infection. And case B is saying another patient has a tooth with severe type 4 fracture and open apex and necrotic pulp in a immature permanent tooth. Which of the following statements is correct regarding the treatment of these cases? Which of the treatment is correct? These 2 cases. Yes, option 1. The pulp is vital. So, treatment of choice will be exogenesis, continued growth. So, revascularization and treatment of choice for the first case, MTA, apical barrier, because the pulp is necrosed. So, we need to induce a apical barrier. That case. Here, So the next question is saying, who coined the term stretch reflex? Stretch reflex. Yes, this is the direct question. Was given by the stretch reflex term was given by Sherrington. Was given by Sherrington. Full name is Sir Charles Sherrington. Sir Charles Sherrington. Here, at what stage is child chewing converted into adult chewing? At what age is child chewing is converted into adult chewing? Child chewing is vertical, up and down. Adult is lateral and rotatory. Lateral and rotatory. When the permanent first molar erupts, this is the transition age. In this age, क्या होता है? जो child chewing will be converted into adult chewing. And the permanent first molar will erupt. Clear? Yes, am I clear? Now, the next question is, what is the concentration of SDF that has proven effective anti-AIDS activity? Very simple question. Very simple. 38% SDF has the potential of arresting the caries. 38% of SDF has the potential of arresting caries. 38% concentration of SDF has the potential of arresting caries. Yeah, very simple question. चले आगे. Now the next question is, what does a moderate score on Dean's fluorescence index represent? As I explained to you last time also, when the white opacity is affecting more than 50% of the tooth surface, है ना, more than 50% of the enamel, and with brown staining हमारी उसमें start हो जाए और white opacity is more than 50% हो, तो क्या होगा? That will be moderate. That will come under which category? Moderate. Remember Dean's fluorescence index? Yeah? When the white opacity is affecting the 50%, more than 50 of the enamel surface and accompanied by slight, the brown staining has also been started. Will be given as the moderate. Clear? There. So this was about the today's session. I hope you all have understood the things. See, too many direct questions also come in the exam. You just have to mug up the important points. See, SDF हमने कितनी बार देखा है, it has been repeated many a times. उसकी concentration पूछी गई है, उसका chloride की concentration पूछी गई है ना? There is in which condition it is indicated, it is not indicated like that. So your concepts should be clear, right? They should be clear. I hope you all have understood the things. Thank you so much. Good night.